and welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to share an exciting milestone with you, our audience. The Center for Public Health Continuing Education has been producing Public Health Live since 1999, and last month marked our 175th episode of Public Health Live. We would like to thank our audience for your continued interest and support in the show's journey over the years, and look forward to many future webcasts. As for today's show and our future shows, we ask that you please fill out your online evaluation at the end of the webcast. Continuing education credits are available after you take our short post test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best serve your needs. As for today's program, we will be taking your questions throughout the hour by phone. The toll-free number is 1-800-452-0662, or you may send your written questions by email. Please email us at any time throughout the hour at phlive.ny@gmail.com. Today's program is Human Trafficking, a public health perspective on a human rights issue. Our guests are Christa Stewart, the coordinator of the New York State Human Trafficking and Unaccompanied Children's Program at the Bureau of Refugee and Immigrant Assistance at the Office for Temporary and Disability Assistance. Also with us is Pesso, the director of the Human Trafficking Program at My Sister's Place. Thank you both very much for being here. We're excited to have you on the show today. Now, Christa, let's start with you. We have a very serious topic to talk about today, and I'm wondering if you can start by just helping us as a group and helping the audience conceptualize what we mean when we're talking about human trafficking.
Right. So it is, I think, very easy for us to understand how commodities are packaged and sold in supermarkets and how things get transported, whether they be cattle or steel. But it's very hard for us to understand that actually human beings are treated like commodities and are in that same situation today.
So if humans are being used as a commodity, this really, in essence, is a form of slavery. Is that correct?
It is. Unfortunately, it is considered modern-day slavery because the victims of human trafficking are denied all kinds of liberties and access to freedom.
And when we're looking at the finer details of this picture, are we talking about children? Are we talking about adults? I mean, who is a victim of trafficking? Who's being sold as a commodity?
Unfortunately, anybody can be a victim of human trafficking. It could be your brother, your sister, your parent, it could be your relative, your neighbor. It affects everybody from all kinds of socioeconomic levels and all types of backgrounds. We do know that many victims of human trafficking are coming from areas that are very disorganized, that are facing vulnerabilities. For instance, the recent storms might lead to vulnerabilities that might lead to trafficking. But generally, we are seeing people coming from very desperate circumstances, and people are looking for a better way of life, which leads them into trafficking.
Now, this is something, obviously a very serious problem, and as you've just described, affects a wide variety of people. But I think it's something that often people are unaware of. So how common is this? How pervasive of an issue is human trafficking?
Unfortunately, it is estimated that 27 million people worldwide are in some form of slavery. And most recently, they've found in the United States that number could be anywhere up to 80,000 people at any given time are in some form of indentured servitude or forced work. So it is a very pervasive problem. But as you recognize, the statistics are not as forthcoming as we'd like because the problem is so underground and so hidden. The victims themselves are afraid to come forward, so in that instance we don't have a real good sense of who is actually being victimized right now.
So we've got that number of 27 million, but there could be many more, is what you're saying.
Exactly.
Now, you referenced that it's a problem, even here in the United States, but this is a global phenomenon. So can you talk a little bit about that picture?
Yes, it is a global phenomenon, and fortunately the United Nations took action in about 2000 to address this problem, recognizing that it's crossing many different borders. Unfortunately, it does happen within countries as well, and we see our own problem here in the United States of victims being trafficked that are born here, but because of certain vulnerabilities, end up in trafficking. But it affects every single country, whether they're first world nations or developing nations, and it affects every country according to the United States Department of State Trafficking in Persons report.
So looking a little bit closer to home then, if it affects every country, obviously that includes us in the picture. So can you talk a little bit about the specifics of human trafficking in the United States?
It does affect the United States as well, and the United States followed the international effort by creating a law here in the United States to address human trafficking. Again, the numbers are very generalized, but we do know that New York State is one of the top 4 states to actually receive victims. We're a big transportation hub. There are many economic opportunities that might lend to trafficking, so we do know that New York State itself is also a hub of trafficking.
Now, it's interesting because if New York State is a hub of trafficking, yet I feel like this is a dialogue that doesn't happen very frequently. There's not a lot of awareness about how trafficking occurs. So can you talk a little bit about the process of how trafficking actually happens?
So trafficking is a process, and that is important to understand because it's often not as clear-cut as is portrayed in the media, where somebody is kidnapped off the street and put into a brothel. Unfortunately, trafficking can often occur over a number of years where the person is being promised something and ultimately believes that that promise will come true, whether it be for work or to repay a debt that they're owed. They're transported often or brought into a situation, and then those promises turn out to be false. They often have no access to their passport or other documents. They're often told that if they report their situation to the police, that very bad things can happen to them. Very often their family members are threatened, and they themselves face some severe physical and mental harm. And all of those conditions keep a person in that condition of servitude where they don't feel free to leave. And that could be for either the purposes of forced labor or forced prostitution. But that essentially is how trafficking occurs. And it's important to note, as I mentioned earlier, that it doesn't require the crossing of an international border. Somebody can be born in one part of New York State and trafficked to another part, and that still constitutes trafficking.
Now, you mentioned that it could be forced into prostitution or other types of labor, and I think that generally when people think of trafficking, the first thing they think of is prostitution. Can you talk a little bit, though, about the broader picture and what else might be included in human trafficking?
Yes, so we do know that trafficking occurs anytime there's an opportunity, unfortunately, to exploit somebody. And most often those types of conditions occur where it's very hidden. So often we do see trafficking occurring in domestic work, people that don't have access to the outside. We do see it in construction industries, in commercial industries that might not be as regulated, like sweatshop type conditions, as agriculture, restaurants, service industries. So it could be a whole range of types of trafficking that occur. And also in the intimate partner aspect, there might be some forced marriages as well that could also be considered trafficking. So it does occur over a range of types of industries and situations. And often the connection between forced sexual servitude and forced labor is very closely connected, so it's not easy to break that out often.
You know, so it's not easy to break that out, and you mentioned before that things are underreported. So obviously the data we have is not necessarily a complete set of data, but is there data available that breaks down what types of trafficking occur more frequently?
Well, we do know that the majority of victims are identified when they're in situations of sexual exploitation. So we do know right now that our statistics show that many people are involved in sex trafficking. And they may have originally been involved in labor trafficking and in hoping to pay off their debt more quickly, get involved in sexual exploitation because it helps to repay the debt more quickly, unfortunately. But again, it is in all types of industries, but our statistics do show that there are those kind of hotspot industries that are more likely to have trafficking occurring within it.
I see. Now, has there been any response to this? And again, on a global level, an international level, is anyone doing anything?
So the United Nations does have a protocol that addresses trafficking that really encourages nations to look at their own laws and prevention efforts to really tackle this problem globally. And in turn, the United States as well enacted legislation in 2000 to respond to this. And importantly, it looked at the problem in sort of a multifaceted approach, where the United States said we have to actually protect our victims here that are uncovered, we have to hold the traffickers accountable, and we have to try to prevent this from happening in the first place. We know that the United States has a lot of opportunities here, so people are drawn to our opportunities, but what can we do abroad as well to help prevent that situation from happening? So all of that led for the Trafficking Victims Protection Act to become law and really look at all of those different areas. And importantly, it recasts how we consider trafficking persons. In the past, they might have been dismissed as, undocumented persons that don't have any rights, or perhaps just a prostitute who got down the wrong track in life. But the Trafficking Victims Protection Act really helps us see that those people are at core, they're victims.
So the Trafficking Victims Protection Act, that was our federal response that came after the United Nations?
Yes.
Excellent.
Yes, and importantly, it offered a really important remedy, especially for those people that are not born in the United States. It offered legal status for people that come forward that will help to find the trafficker and access much needed services.
And what about in New York State? Do we have any specific protections here in our state of New York?
So in 2007, we actually did enact a state law, and importantly, that does help put a definition around the problem. It's similar to the federal law. It looked at holding traffickers accountable by increasing criminal penalties, and it also helped to do some coordination of the state by developing a state task force. And importantly, from my perspective, it offered victim services. So we've been able to create a response to human trafficking program to address the much needed services that victims face when they're identified.
So within New York State, who are some of the agencies that are working together that are involved in addressing the situation?
Well, under our interstate task force, our interagency task force, we have 10 state agencies. That is co-chaired by the Division of Criminal Justice Services and the Office of Temporary and Disability Assistance. But we also have 8 agencies that are really integral to understanding what trafficking is and how we can respond as a state. So they are mostly law enforcement agencies like the state police or Department of Labor, which has an enforcement component, or they are service type organizations like the Office for Children and Family Services, the Office for Victim Services, the Office to Prevent Domestic Violence, Office of Mental Health, and Department of Health. So all of our agencies come together to try to look at how we can respond as a state and make sure that the barriers that may exist are not there for victims.
Well, it's great to hear that there is this collaboration, that all of these agencies are coming together, since it is obviously such a complex problem that everyone's kind of putting their heads together to try to make a difference and address the situation.
Yes.
Now, we had the opportunity to meet with Sujata Warrior from the Office for the Prevention of Domestic Violence. And Sujata spoke to us not only about training initiatives, but also about the intersection between human trafficking and domestic violence, and how public health professionals can help. Let's hear from her now.
So domestic violence and human trafficking are similar in some ways, basically because it occurs on a continuum of violence. It's about power and having the power to control people through a wide variety of tactics. Victims have the same impact in terms of their health, trauma. Also, the commonality is that levels of isolation, threats of immigration and deportation, the use of the law to control victims, both in domestic violence and trafficking. But the one major difference between domestic violence and trafficking is that usually in trafficking there's a wide network of traffickers. Often you can't track everybody. You may get the low-level trafficker, but you don't get the sort of higher levels that are behind trafficking. Also, there may be multiple victims, and sometimes when you're looking at especially labor trafficking, you may get, actually women who are also part of the traffickers. So it becomes really hard to distinguish sometimes victims and traffickers, but you have to really do very, very careful assessment. We do a lot of training on domestic violence across the board for all professionals in all the various systems, from child welfare to criminal justice to health. The content of the training, for the most part, it is what is trafficking, who are the victims and perps, what's the data that's available, some of the consequences for victims, and then what's available to hold traffickers accountable. The public health force collaborates sort of inconsistently. I think some places in New York we've had a long history of working on trafficking. So, example, I know for New York City, because the Mayor's Office to Combat Domestic Violence, Sanctuary for Families, New York Asian Women's Center, were all working on trafficking, including Safe Horizon. So there's been a long history of collaborating with health, because healthcare providers do see trafficked victims and sometimes, traffickers in healthcare settings. The way to get a more consistent level of support from Department of Health would be for all areas of health to know what the issue is, so to be aware of it. So I think having many parts of DOH having gone to the GOA training, we're hoping that once there's a certain level of awareness, then we can figure out, well, what is it that we want healthcare providers to do? What is it that we want physicians to do? What do we want nurses to do? What do we want, paraprofessionals to do? First and foremost, safety is paramount. And safety may look a little different for trafficking victims than intimate partner violence or domestic violence, because there may be multiple traffickers. You don't know who's showing up. Sometimes traffickers have been smart enough to say, we are service provider who actually works for their safety and health. So people don't know how to sort it out, who is the grassroots provider and who is claiming to be when they're not. So really focusing on safety, ensuring safety, taking care of whatever the health concerns may be of that particular victim who's showing up. That's what we say, right? Always in domestic violence, you assess, you figure out what's going on, you routinely screen across the board all female patients, and we say not just adults but even teenagers now, because as we know more and more of what's going on. So it would be the same thing. It would be routine screening, assessing, really finding out what's going on, knowing what the resources are, so we refer them to resources, and then really documenting what it is that they've found in their assessment, what the patient is saying. But most importantly, really to focus in on safety. Safety is really paramount. It's paramount for domestic violence victims. It's also paramount for trafficking victims. And that is really what providers should focus on.
So one of the things that Sujata talked about was sort of this overlap between domestic violence and human trafficking and the similarities. And so keeping that in mind, I would imagine that one of the challenges we face is simply identifying who the victims are and getting them to come forward. Can you talk a little bit about that?
Well, much like domestic violence, it can affect a range of people who get involved in trafficking. And there are often those very similar vulnerability factors. People that might not have access to services are really affected. People that have a past history of trauma and may not be comfortable talking about their circumstances are those people that might be trafficked.
And are there certain red flags that might point towards trafficking or might kind of indicate something is going on?
So there are some indicators that might lead one to question whether somebody is trafficked. Often people that are in a situation where they are accompanied by somebody who will not sort of leave their side, who seems to exert some authority over them, people that don't perhaps have their identity documents, people that seem not to be familiar with their surroundings, and those are some indicators that show that the person is possibly not sort of in control of their own actions.
So given that we've got certain indicators, but there is still this difficulty in getting people to talk about their situation, what are some of the challenges really that are facing us in identifying the victims?
Yes, that is sort of the main problem that we do have with human trafficking, in that the victims are often so threatened and coerced that they are afraid to kind of self-identify or indicate what is going on with their own circumstances. So I think that as long as we're aware of some of these red flags, we might be able to help piece together something that's going on with an individual and help them to understand their circumstances and get out of the situation.
Now, what are some of the more effective ways as a provider to really try to reach someone? I mean, given the level of fear that might be existing and the number of barriers you've discussed, what are some effective strategies to try to engage someone to get them to talk about their situation?
Well, I think that's exactly it. What you're saying is really the core of this is engagement and understanding that a person may not be willing to disclose all of their circumstances, but if we're more aware of those circumstances, we may be able to help them get out of their situation. So the key is sort of engagement, as well as sort of gently probing if you feel it's appropriate to find out if the person is in need of help in some way.
Now, if somebody encounters a patient and they suspect that there is human trafficking going on, what should their next steps be? I think a lot of people are unsure. I mean, it's such an unfamiliar territory. What do they do?
Well, I think that is a difficult area because we're starting to learn more about the issue and starting to understand what trafficking actually is, but that next step is often very difficult for a provider. Fortunately, there are resources out there, and our office at OTDA is always available to help people work through those types of difficult questions. But we also have some national resources. We have the National Human Trafficking Resource Center that does operate a 24-hour multilingual hotline that can help people work through those situations and identify sort of appropriate next steps.
So if somebody is working with law enforcement or is a mandated reporter, should they be calling your office?
So in New York State, if you are a law enforcement officer or working with law enforcement, you are required to submit a referral to our office if you believe that the person you're working with is a victim of trafficking. And that referral is assessed by our office and Division of Criminal Justice Services, and the main purpose is really to try to identify services for that individual at that time. If a person isn't a law enforcement officer and believes they are in contact, again, they should feel free to reach out to our office or one of the national hotlines to try to connect them to other services and service providers.
Great. It's good to know, again, that the agencies are there and available to provide these resources that individuals or healthcare providers might not be familiar with.
Yes.
Now, OTDA and the Department of Criminal Justice Services work very closely together on this issue, and a third partner is the Office for Children and Family Services. We met with Lynn Baniak from OCFS to talk about the role that her agency plays in the process. Let's hear directly from Lynn about her agency's involvement.
The Office of Children and Family Services provides oversight to the local departments of social services, including the Administration for Children's Services in New York City, as well as authorized voluntary agencies. And the oversight that we provide is in relation to child welfare, family services, juvenile justice, domestic violence. OCFS doesn't provide a direct role to providing assistance to human trafficking victims. However, we do provide a supportive role. Since the law passed in 2007, that's the anti-trafficking law that I'm sure you're hearing all about today, OCFS has been involved. We work very closely with our partners at the Office of Temporary Disability and Assistance, as well as the Division of Criminal Justice Services. Currently, we have a project going on called the Child Right New York Project, where we have a contractor we're working with, the International Organization for Adolescents, otherwise known as IOFA. And this project is similar to something they did in the state of Illinois with building a child welfare response. Child trafficking victims are identified. At this point, really, it's just someone being aware of what the signs are, noticing something isn't quite right, and then making a report of it. Through the project that I mentioned earlier, the Child Right Project, we are going to be developing a validated screening tool for child victims. So once that's complete, I'm sure it'll be available on our OCFS website. Other stakeholder agencies, in addition to our child welfare agencies, will have access to that and can use that in their work, including public health staff. Also, as far as like what you should look for, I mean, I think basically anything that just doesn't seem right, something that seems suspicious. If you have especially a young child with multiple sexually transmitted infections or multiple pregnancies and abortions, if you have a situation where you have a child there and you have an older controlling boyfriend or family member, and they don't seem, the child doesn't seem to be able to talk for themselves, that would be a warning sign. Basically, there is a process for confirmation or certification as a victim, but for the purposes of the Office of Children and Family Services, when a child victim is identified, immediately they're going to send a notification to that local district, the Department of Social Services there. And that person will need to do an assessment. Now, the assessment immediately would be whether that child has safe housing, and if they don't, then we have to look at what housing options we have. And then also, are there any immediate needs, such as health needs or mental health needs that need to be addressed right away? Currently in New York State, for child victims, we don't have a lot of housing specifically for child victims of trafficking. And we don't have a lot of agencies that can provide specific services for that population. So we're a little limited with, when we do have a victim, what resources exist. It also varies widely in that I think, down in New York City, there may be some more services available and more housing available, and upstate, there may be less so. Public health workers, first and foremost, can be a first line of defense in that they're often seeing these victims, whether or not they realize it at this point. They are seeing victims in most cases. So being aware and questioning, by questioning, I don't mean sitting and firing off a bunch of questions to a child. I mean in your mind, if you see some red flags, if you see something that just doesn't seem right, questioning in your mind whether or not this person's a victim and trying to engage them. And it might take a while, it might take several times of seeing them and speaking with them to do that. But first and foremost, I think being that point of contact that notices something isn't right and does something about it is first and foremost.
So it's great to know that OCFS and OTDA, that you guys work very closely together and to have an idea of what it is that OCFS is doing. So can you share with the audience a little bit about when they make a phone call to OTDA, what can they expect during that phone call?
Well, what we're really trying to do is figure out how the victim is responding and whether they need really critical services. Are they safe? Do they need shelter? Are there issues that we really need to plan for immediately, like whether they have children or perhaps a serious medical issue that needs to be addressed? Those are sort of the things we'll try to triage before we place them with a service provider to make sure that we are addressing all of those service needs immediately. So having that information, if you are making the call, would be very useful.
And what are some of the things that happen once a referral is completed?
So once a referral is completed, we're able to place that person with a really good, trusted service provider to address all of their service needs. And those service providers work within a case management framework to really identify what those needs are and to help the victim work through the case as it moves forward. So those service needs, and I'm sure you'll learn more about them from my colleague, really address kind of the gamut of needs that a trafficked person might have, whether they be shelter or health or legal services or longer term care.
And are there other agencies, once you make the referral, other agencies that get involved with the process?
So there really are a number of agencies that are integral to the process of either holding a trafficker accountable or providing services for a victim. And often we find that not one agency sort of provides all of those services, so we often work in a multidisciplinary framework. Because all of those pieces really are critical to making a victim whole again and making sure that we stop the trafficking. So often it could involve federal or local law enforcement, it could involve a legal service provider, a case management agency, the healthcare providers, of course, and a range of other sort of longer term service providers that help stabilize that client.
Now, with the help of all of these different agencies, do cases ever come to light? I mean, do we see any coverage of this, or are there examples?
Well, unfortunately, there has been cases that have come to light. And most recently, we've seen in the news some coverage involving cases actually here in the Capital Region, involving both domestic work and some other forced work within the homeless services arena, unfortunately. And we've had some very large cases uncovered that are almost unbelievable. We've had a case that was operated by an elderly grandmother from her home country and sort of manipulating a lot of younger women involved in relationships with young men in prostitution. So we do see sort of a gamut of cases in New York State involving a range of types of trafficking. And on the positive front, we are making headway. We are identifying and seeing that these cases are prosecuted, but more needs to be done.
Sure. Well, and it seems like, I mean, even describing that a grandmother running a trafficking organization is not what you would expect. And I think that's one of the key messages is you can't expect a certain thing because it varies and affects so many different populations. So would you say that one of the key things is having a number of different organizations working together if we really want to make more headway?
Well, we do feel that having a multidisciplinary approach is best for the victim, and as long as all of our agencies are sort of familiar with each other and keeping the victim at the core, we'll be able to make some really good progress, because there really are very important roles that each of those agencies do play. One of the things we do with our Response to Human Trafficking program also is to help try to coordinate some of these agencies on the regional level. So we do have some local task force development and community education that's going on as well.
Excellent. Well, thank you so much for all of the information you've shared this morning.
Thank you.
Now, Lauren, Christa provided us with quite a bit of information regarding human trafficking and how it happens. Let's talk a little bit about how human trafficking relates to public health.
Thanks. And I think, as Christa mentioned, this issue is getting more attention slowly over time, and that's a really great thing. But I think often when people think about human trafficking, if they do, they may think of it as a criminal justice issue, a legal issue, maybe an individual psychological issue. And I think we really also need to think about it as a public health issue, because we know that that human trafficking affects not only individuals, but it affects families, entire communities. It contributes to the global public health burden, and I'll talk a little bit more about the ways that that happens, whether it's mental health, physical health, poverty-related issues. So this is really something I think we need to think about in terms of public health.
And from your standpoint, why would you say that it's important that we're training public health workers?
Well, we know that human trafficking survivors and victims encounter various healthcare systems. We also know that trafficking victims are at high risk for healthcare problems, and I'll talk a little bit more about that. And one thing we know, and Christa mentioned this, is that often victims are hidden in plain sight. So if you're not looking for them, you're not going to find them. So that's why we think it's so important, and OTDA and my organization, My Sister's Place, and many others, make a real effort to train healthcare providers, because you only see what you look for. And so identification of a case is crucial, and then knowing what to do when you identify that case is really the only way that we're going to help address this issue.
Now, you're saying you're only going to see what you're looking for. How often are providers going to see a human trafficking person? Are victims of human trafficking actually seeking help for the services that they need?
We know that sometimes they are. We don't have great data on this. There have been some studies. There's one study that showed that close to 30% of victims who are a part of this study had sought medical services during the time that they were in the trafficking situation. We also know that many survivors of human trafficking are not allowed to seek medical services while they're in the situation. However, they may escape their trafficker and then many years later seek medical services, and they still may need access to rights. They have rights that they don't know they have. They may need other kinds of services. So we know that survivors of human trafficking are encountering the public health systems in all sorts of ways, whether it's after an emergency, after a physical or sexual assault, related to sexual and reproductive health issues, or for unrelated health issues that if a healthcare provider knows what to look for, they can help identify potential indicators of trafficking as well.
I see. Thank you. Now, so if victims are being kept in unsafe conditions and often not allowed to get medical treatment, I would suspect that after a while there's going to be quite a few physical health consequences. Can you talk about what some of those would look like?
Sure, and every survivor, every case is different, so we're not going to see all of these issues in every case of human trafficking, but we know that there are particular kinds of physical health issues that are common. So for instance, many survivors that we've worked with have untreated illnesses or chronic illnesses, and that really depends on what they've been forced to do, what was the trafficking related to, whether they were forced to work hard manual labor, were they working in unsanitary conditions. So there are often associated conditions that may not be directly related to the trafficking, but related to the work they were doing. Many of the survivors I've worked with have had significant dental problems and needs, and this may be because they weren't allowed to seek dental care while they were in the trafficking situation, or if they've come from another country where they were never able to access dental care earlier, that can be an issue. And then some clients I've worked with have had, as part of their abuse, they may have teeth knocked out by a trafficker, and so they have some real significant dental needs. We see clients and patients who've experienced sleep deprivation, malnourishment. Drug and alcohol dependency is unfortunately common, whether it's because somebody's using drugs and alcohol as a coping mechanism, or because traffickers sometimes use drugs and alcohol to keep somebody in a trafficking situation, have that person keep coming back. And so when people often ask, well, why doesn't somebody leave? Sometimes that's the reason. We also see sexual transmitted infections, pregnancies, sometimes unwanted or unsafe abortions. And I think it's important to note that this isn't just for people who've been trafficked into commercial sex, but as Christa mentioned, sometimes there really is a thin line between sex trafficking and labor trafficking, and some traffickers will use sexual abuse and assault as a way to keep somebody in a labor trafficking situation. So we have to think about that also. And this, I want to point out also, is not just a problem for women. It may also be a problem for men, and many of the survivors we work with are male. And then finally, one thing to mention is that you may see branding or tattoos, unwanted tattoos, and this can be because some traffickers, we often hear, particularly pimps in a sex trafficking situation, will use tattoos and branding to mark their group of victims, you know, as they would cattle. So this is something to look for also.
So quite a few different physical health conditions that might manifest depending, again, on the situation. What about the psychological health effects of trafficking? Because I would imagine that's just as great of an issue.
Yeah, and I think this may be what public health professionals assume is more likely, that they'll be more likely to see. And again, everybody experiences this differently, and this can be based on a whole host of factors: how long the person was in the trafficking situation, what work they were forced to do, whether they had any underlying mental health issues prior to being trafficked. But we see a lot of, and I've seen in the work that I've done, most clients that I've worked with have had some level of psychological distress as a result of the trafficking situation or as a result of getting out of it, depending on what's happened to them since they've gotten out of it. So we see a lot of things we expect with PTSD, whether it's anxiety, depression, flattened affect. Many clients that I've worked with experience shame or humiliation as a result of having gotten into the situation, either because they can't believe that they allowed themselves to get into a situation like this, or they're ashamed of what they were forced to do, whether it's commercial sex work or some other kind of work that they felt was demeaning. Memory loss, dissociation. Many clients experience isolation. Whether they're U.S. citizens or foreign nationals, they may have been prevented from speaking with their families or communities back home. So we see a lot of this. Inability to trust as well, which is really, I think, a challenge for healthcare workers when they're encountering someone they think might be a victim. It may take a very long time for that potential victim to feel that they can trust that healthcare provider. So that's something to be aware of, and it's a challenge, but it's not insurmountable.
So certainly you've provided us with a pretty broad picture of a number of different health consequences or health effects of human trafficking. And given that it's such a varied picture, what are some of the things that a healthcare provider, when they're encountering someone and they see maybe one of these conditions or a couple of these conditions, I mean, really, how does a healthcare provider start to paint a picture and start to realize this might be a victim of human trafficking? Should I ask more questions?
So there are a lot of red flags that we suggest people look for, and I'm not going to go through all of them, and Christa mentioned some, and I believe Lynn mentioned some as well, but I'll talk through a few of the key ones we like to recommend to people. So first, does somebody appear to have few or no personal possessions, especially their legal documents? Do they not have access to their legal documents, whether that's a passport or a state ID? And this is in part because we know that traffickers will sometimes take away legal documents from a victim to prevent them from leaving, and they may say, well, now if you leave the situation, nobody will believe you, you may be deported, you may be arrested. So if you can tell that somebody doesn't have access to these things, that may be a real red flag. Limited knowledge of one's whereabouts. So do they not have a sense of where they are or where they've been living? And this might be because of some of the psychological issues they've been experiencing, but it may also be because one tactic that we know traffickers use is that they sometimes move victims around from place to place so that that person is never able to make associations in the community and doesn't know who they can speak with. Also, and I think Christa mentioned this, but it's worth repeating again, is somebody's communication, does it appear that it's being restricted or controlled? Is there somebody who's always speaking on behalf of that patient? And this makes sense because traffickers know that if you give a victim a potential opportunity to speak to someone outside of the trafficking situation, they might tell people what's happening. So, and this is tricky, particularly when we have survivors or victims who don't speak the language of the healthcare provider, because then it becomes very easy for somebody to come in and speak on their behalf, which is why we always recommend that you need interpreters, and you need high-quality interpreters available so that you can speak with a potential victim. We also, we suggest people look for signs of trauma, neglect, injury, and these are all the things we talked about in terms of the physical and psychological consequences. Does the person seem particularly fearful of somebody in authority, which could include a healthcare worker? And this might be because traffickers have told them, if you speak with somebody that will hurt you, will hurt your family, or they won't believe you, you're undocumented, or you're a sex worker, and why would anybody believe you? So these are things we suggest people really look for. And then finally, is somebody else paying for the patient's medical services on their behalf? And of course, this could mean a lot of things, but this is particularly important because we know traffickers will not want to leave a paper trail. Are they paying in cash? Are they not allowing the person to pay for services or speak with someone themselves? And I won't go into some of the other the issues related to minors because I think Lynn already spoke to that.
So now there's quite a few red flags to look for. There's quite a few different health conditions that a provider could potentially look for. So if someone is able to identify what they suspect is a potential trafficking situation, what can they do to try to make the exam or make the encounter a safe one?
Well, I think we need to really look to other areas that have done work on this before, whether it's domestic violence or sexual assault. So some of these things will seem, I think, somewhat basic, but they're really critical, I think, to creating a space where somebody might come forward and say something. So the first thing we want to let people know is that, and remind people, very rarely will somebody raise their hand and say, I'm a victim of human trafficking. They're not going to come to you and say that. It's more likely they're coming to you for some other related issue. And so you have to know what to look for and to really be vigilant. We also want to remind people that a patient may be accompanied by a spouse or a friend or a boyfriend, and that person, or a parent for that matter, and that person might actually be the trafficker. So again, it's why it's so important to have somebody alone, to have some time alone with the patient so that they can speak on their own behalf. And this can be challenging depending on the setting, but we encourage people, depending on what's appropriate in your setting, to ensure that you always have some time alone, whether it's telling the person that's accompanying them, this is our practice across the board, we always meet with the patient alone, even if it's a minor and you just suspect that something is off. Interpreters are critical, as I mentioned. In terms of speaking about some of the sensitive topics that might come up, including sexual health, including immigration status, we suggest that people really build rapport before they delve into those topics. And we'll talk about some of the questions that you can ask, but those probably shouldn't be the first thing that you ask about. And then carefully observe somebody's body language and their communication style, because again, a potential victim is unlikely to come out and say, I'm a victim, but if you get a sense that something's going on, you can probe a little bit deeper.
Now, you mentioned that one of the things that you would emphasize is the importance of building rapport before you start asking some of these very sensitive questions. What are some of the questions that you would recommend a provider ask, either to build the rapport or to have a safe way of asking questions that'll get at more information?
And again, there are lots of questions we suggest, and I'll go over some of them. If somebody's accompanied by another person, you might ask, who's the person who came with you today? Can you tell me a little bit more about them? And you can ask it in a neutral way, but just to get a sense of, who might they be accompanied by. You can ask if, in a work setting or any other setting, has anyone ever pressured you to do something that you didn't feel comfortable doing? And then you can probe a little bit more if they seem to respond. Is anybody hurting you? Has anybody threatened you or threatened your family? Has anybody taken your legal documents? And I explain why this is important to ask. You can ask them about the kind of work that they do, and then you can ask, do you feel like you can leave your work or your job if you choose to? Do you have to ask permission to do some of the very basic things like go to the bathroom, like to eat and sleep? If you have the opportunity to ask about the work environment or the home environment, are there security features, are there locks on the doors, that sort of thing, that might prevent somebody from getting out. And then if you've had the opportunity to build rapport, you can ask about whether that person has been forced to perform sex acts against their will. Or you might ask, do you know anybody else that this has happened to? Because sometimes we've found that survivors won't be willing to talk about what's happened to them, but they might be willing to talk about what's happened to somebody else. And this is important because it might give you insight into actually what's happening to the patient in front of you, but it also might give you insight into, are there other victims? And that's really important to know as well.
Sure. So in asking these questions, obviously knowing what to ask is very important, but then equally important is how do you respond and what kind of message do you want to send to the victim that's presenting. So can you talk about some of the messages we want to be sure to convey?
Yeah, and I think some of them, again, are simple but so important. So we're here to help you. Our first priority is to keep you safe. And to the extent that you can, let people know that the conversation you're having is confidential. We're not going to share it with the person who came with you. We're not going to call the police unless you give us permission to do so. And we'll give you medical care that you need, whether you decide to talk to us or not, and I think that's really important. We want people to know that there are services available, so we can help you find a safe place to stay. We can help you get what you need. You have rights in this country as a potential victim of a crime. You've been a victim of a crime, and you're entitled to assistance in the ways that Christa described.
Now, you said one of the messages to convey is that, we can help meet your needs. So working at my sister's place in a shelter, can you talk about what are some of the needs that survivors tend to have, and what are some of the services you're able to provide?
Well, the needs are so varied, but very often, in terms of the immediate crisis, people need shelter. They need a place to stay, whether that's in a designated shelter or they just need a safe room in a hotel. They often need legal assistance and representation, whether that's for immigration issues, criminal issues, civil issues. Language interpretation is key, so we always encourage people that we need to set that in place. And one of the challenges there is that if you're operating in a small community where there may be very few people who speak a given language, you have to be really careful about who the interpreters are. So we want to make sure that that interpreter isn't allied with the trafficker or doesn't know the victim. So we screen interpreters as well. Safety planning is critical. So whenever we meet with a victim, one of the first things we do is we work with them to help identify how we can keep them safe and they can keep themselves safe, and to the extent that we can help keep their families safe as well. And that may mean taking a different route when you're walking around town. It may mean getting rid of a cell phone that the trafficker gave you. So there are a whole host of ways that we can assist people with that. And then very often people have concrete needs, and these are sometimes the most critical immediately after they've left the trafficking situation, whether it's clothes, food, a phone to call their family members, or phone cards to call their family members. And these are the kinds of things that we work with Christa's office at OTDA and our federal partners, where we have access to resources to help get client services that they need. And then counseling and support and advocacy, and that's something we do on an ongoing basis for victims.
Sure. And now your organization is located in New York City, but we do have resources.
Westchester County, actually.
Westchester, okay, thank you. And we have resources hopefully throughout the state, and specifically here in the capital region. We had the opportunity to talk with Lindsay Cruzen, a local service provider in Rensselaer County, about trafficking patterns that they're seeing here in upstate New York, as well as the services that her organization provides to victims. So let's hear what she has to say.
Cruzen. I'm the director of the Sexual Assault and Crime Victims Assistance Program for Rensselaer County at Samaritan Hospital, which is part of St. Peter's Health Partners, and I'm also the coordinator of the Rensselaer County Sexual Assault Response Team. Our organization provides free and confidential services to all victims of all types of crime throughout Rensselaer County and the surrounding areas. This could include acute services in the emergency department, things like crisis intervention and service referrals, but could also include more long-term services such as long-term counseling or therapy, medical and legal advocacy. If they do report the crime to police, we can go with them when they make those police reports, when they have interviews with the detectives. And if their perpetrator is being prosecuted for the crime, we can go with the victim to court or meetings with the district attorney's office. So we really can be there for victims through the entire process. So human trafficking, unfortunately, is a very real problem here in our capital region as well as throughout the United States. Our program has seen quite an increase in sex trafficking victims presenting themselves, but oftentimes we work on cases and we might not even know that it's a sex trafficking case. We know over the past year that we've worked on a few cases involving victims of sex trafficking, but if they don't disclose to us that they're being trafficked, we may have no way of really knowing. There are many different types of health concerns that victims of sex trafficking may suffer from. Those can be physical issues, such as sexually transmitted diseases or infections, or common infections that might be easily cured by a medical provider that have gone untreated, and so they've become more problematic. But we also see a lot of psychological health issues, things like anxiety disorders, depression, especially post-traumatic stress disorder. I would say that one of the biggest obstacles in working with sex trafficking victims is the relationship that they have with their abuser. Unfortunately, despite what we might all think looking in from the outside, there's a very tight bond that is formed between this victim and the person who's abusing them. And even if they're being treated poorly, this might be the most consistent person that they've had in their lives for a very long time. So for them to essentially, turn them in and feel like they're turning their backs on that individual, it's very, very difficult. If a healthcare provider suspects that someone that they're working with is a victim of sex trafficking, the most important thing to do at first is to treat that person with compassion and respect, and recognize that every victim of sex trafficking is different and might have a very different reaction than you're expecting to the questions that you ask and the concerns that you have for them. So most importantly, let them know that you respect them and are there to try to help them. Other recommendations would include contacting a crime victim assistance program, such as the one that I work for. We are able to provide free and confidential services that a victim might feel comfortable accessing. There's really no way that their abuser would know that they were here, at least from us. You could also talk to the victim about whether they are willing to involve law enforcement and make a law enforcement report and make a police report from your office. It's really important to also provide referrals and information to that individual. However, we need to do that in a very safe way. We don't want to just hand over a card that says, "Are you the victim of sex trafficking? Here's some help." Because what if their abuser finds that? They're going to be, they're going to be in a lot of trouble with their abuser. So I would recommend coming up with some kind of system that you can use to convey that information in a way that's safe.
So locally, that's obviously a great resource for individuals if they're looking to find more information or provide a referral. But Christa, are there other resources that you would recommend that we provide to individuals as well if they're looking to get more information on this topic?
Well, yes, again, the National Human Trafficking Resource Center is an excellent resource both for emergency situations and identifying service providers, but also for training and technical assistance. They have a wealth of information and their website is wonderful as well, but they really do provide a lot of information about the different types of trafficking and resources in the local community, so that is a wonderful resource. Again, working with youth, you might be in touch with the National Center for Missing and Exploited Children that also has a wealth of information and contacts that can help you work through a case. And lastly, the Department of Justice also has a 24-hour toll-free worker exploitation hotline, complaint line rather, that can help in particular labor situations. So any of those resources are helpful.
And if people wanted to contact your office directly, is there information we could provide them with as well?
Yeah, we are very happy to respond to any questions. You can call myself or my colleague, Erica Haig. While we are not 24-hour or multilingual in all languages, we are able to kind of tap into other resources and actually do have a wealth of language services that can connect you with appropriate services if needed.
Great, thank you so much. And Lauren, is there contact information for your organization as well?
Yeah, people can reach out to me as the director of the Human Trafficking Program at my sister's place, and we also have a 24-hour hotline that's operated out of one of our shelters. The number is 1-800-298-7233. So people can call there 24 hours a day, and if they're not in our area, we can often connect them with another service provider in their area.
Excellent. Thank you both so much. So we've had a few questions come in. I want to try to get through them if we can. The first is, in the absence of adequate response mechanisms for victims of human trafficking, healthcare providers play a critical role as first responders. What policy discussions are happening to raise awareness in public health?
Well, I can address that on the New York State Interagency Task Force level. We have been working quite a lot, and we do know that the first step is training. So we have instituted a Governor's Office of Employee Relations training within all of the task force agencies, but particularly with Department of Health and Office of Mental Health, to make sure that frontline staff are adequately trained. From that step, we do hope to work in more collaboration with the actual service providers to help them identify what tools they might need and to sort of further develop those resources.
Great, thank you. Another question, are foreign or international victims of human trafficking likely to contribute to the communicable disease burden in the U.S. due to poor health and lack of access to care in their primary countries? And that might be, you know, I don't know if that would be within either of your areas of expertise, but they're specifically asking, for example, about AIDS, tuberculosis, things of that nature.
I can't speak to any data that I know of that shows that. I do think anecdotally we have clients that we've worked with who have come to this country with, they may have other conditions, but I also think we have people from this country who are trafficked who, depending on where they're living or areas of poverty, that may also have such conditions, whether it's TB or HIV. So I don't know. I think it's an interesting question. I don't know the answer, but certainly where you're coming from once you get into the trafficking situation has a lot to do with what you're experiencing in terms of health issues.
Sure. And that might lead to another question. Are there specific racial or ethnic groups that are more likely to be affected by human trafficking?
I think, as Christa mentioned, anybody can be a victim of human trafficking. We know that there are vulnerabilities, whether it's poverty, whether it's being lesbian, gay, transgender, particularly among youth who may be kicked out of their homes. So I think those, and maybe Christa has other things to share, those are some of the groups that we know might be particularly vulnerable in terms of racial and ethnic background, at least in terms of the clients that we've served at my sister's place. It really runs the gamut, both in terms of nationality as well as racial background, ethnicity, languages spoken. So unfortunately, I wish there was a way we could so easily target, well, these are the people we have to look for, but in our experience, it can be anybody.
That really kind of, I've seen the posters, you know, the look beneath the surface, and it seems like what you're saying is really kind of driving down that point that there is no one target group. So with everyone, you kind of have to look beneath the surface a little bit to try to get at the picture.
Right, right.
We have another question. What is happening to bring about a community-coordinated response to address trafficking? And I know you talked a little bit about the task force. I don't know if you want to share any more.
Yes, one of the things that I do think is important that the state is doing is funding local task force efforts. And I believe actually Westchester has one of the best sort of models of how that is including a community response, and that is really sort of integral to their approach. So I would think Lauren might have some interesting points to add on that.
Yeah, for the last 3 years, we've had a local task force in Westchester that brings together federal, local, state law enforcement and government agencies, other service providers, faith-based communities and organizations to really tackle this issue. So both to engage in training so that everybody's trained to identify what to look for, but also then to work together to be proactive in terms of investigating cases and to make sure that when a case is identified in our area, we know the people that we can get on the phone and call very quickly. And there are healthcare providers as well that are part of that task force. And I think that's really been critical in order to improve our response to cases when they come to our attention. I believe there's a task force in the Albany area as well, and around the state and around the country, we're starting to see these task forces starting up, and that's really key. I mean, you have to know who you can call, and sometimes it's particularly helpful if you know the exact person and you know that they're sensitive to the issue and you can trust them, and then you can tell a survivor or a victim, I know this person at the FBI or at the local police department, and I believe that they're going to treat you with dignity and sensitivity, and that may be the thing that helps somebody come forward.
And I think what's also important in that type of approach is that you are working with individual partners that know how best to tailor their message and outreach to their communities. So working within that framework is really critical, I think, to actually getting at this vulnerable population.
Great. Well, thank you both so much for all of the information you've shared with us today. Unfortunately, that's all the time that we have. And thank you very much for joining us today. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain nurse continuing education hours, CME and CHES credits, learners must visit www.phlive.org and complete an evaluation and the post-test for today's offering. Additional information on upcoming broadcasts and relevant public health topics can also be found on our Facebook page. Don't forget to like us on Facebook to stay up to date. And as a reminder, you can download the companion guide to this broadcast on our website, phlive.org. The companion guide will provide you with learning activities to help further your knowledge and understanding of topics covered in today's program. This webcast will be available on demand on our website within 2 weeks, and DVDs of any of our Public Health Live webcasts can be ordered from our website as well. Please join us for our next webcast on January 16th as we address healthy school meals. I'm Rachel Breidster. Thanks for joining us on Public Health Live.